Hi guys, welcome back to my channel. My name is Selenia for those who do not know, and in today's video I wanted to do a video all about the different nursing specialties in women's health when it comes to the roles of being a registered nurse. And I figured that we can do a little rundown in today's video, whether it's between labor and delivery, postpartum, and NICU nursing. So if you're interested in knowing the difference between those three specialties, then keep on watching this video. Alrighty, so just a little bit of background information. I am currently a level 4 NICU registered nurse. However, I've had previous experience in a level 3 NICU. That was my first job straight out of school. I have plenty of videos all about my time of being a NICU nurse, so be sure to check them out on my channel. But you guys are here today to get a little rundown of the differences. So I just wanted to let you guys know that I am a NICU nurse. I've already mentioned that earlier. So I have not been an L&D or a postpartum nurse. However, when I had to float over to postpartum, I know a little bit of what they do because I had to float over there. And L&D, I had to be there when I was there with the deliveries for the babies in case they were not able to stay with their parents or they were worried about them during the birthing process. So just want to get that out of the way. I am no expert on L&D and postpartum. I'm sure there are people that are, but I want to just give you guys a rundown with the difference between the three and kind of getting through like the main roles and responsibilities that they do in case you're interested in any of those specialties. So I have my notes here on my iPad. So let's just get right on into it. So first we're going to start with labor and delivery only because if there is no labor, then there isn't going to be a baby in postpartum or in the NICU. So let's just get all that out of the way. So a labor and delivery nurse, based on my research and what I've seen when I go to the deliveries or when I did previously go to deliveries at my previous job, I saw that nurses are responsible to give the medications to their mothers or to the mothers, which would either be Pitocin or epidurals, any other meds like that, maybe medications to regulate their glucoses, their blood pressure, maybe the doctor wants to add something else on board, maybe an antibiotic, anything of that sort. That is what the labor and delivery nurse does. They also monitor the mother and the baby's saturations. There's a monitor by the bedside that measures the baby's fetal heart tones. Of course, the mom is going to have a regular monitor with their blood pressure, their heart rate, their oxygen, their respirations, all of that good stuff. I just want to let you know I have my French bulldog, who you know are very noisy, kind of next to me in her little playpen so she doesn't like make noises all over the floor. So if you hear that, that's what that is. She sounds like Baby Yoda. So there's that. Let's get back to the video. So they monitor the mother's and baby saturations. It's also good for them to monitor because they know when to call the NICU team in case the baby is not doing well in the fetal heart monitor. Maybe the heartbeat isn't as high as it usually is and it started to desaturate. They kind of know when to call and when also to call the doctor. Other things that they do is they help the mother push during delivery, and they also are like their cheerleader, their coach partner, because labors can be long and strenuous, and you have someone there that is whispering in the mom's ear or giving them a pep talk while they're pushing, letting them know how long they should push for, when they should hold it, giving them some motivation that you can do it, one more push, and all of that good stuff. They also are emotionally supportive to the other people in the delivery room that are kind of helping them, who the nurse is able to help them who are in the delivery room help mom. So kind of tell them what they need to do to make mom most comfortable, what they can do to support her, kind of just build a support system, and they kind of are the ones who run the whole room when it comes to labor. It just seems like the doctor or the midwife is literally asking the nurse to do this, that, and this, trying to make sure that the mom is in a good position, trying to make sure the mom is comfortable as she can be because she's literally giving birth. And also getting the family to kind of be involved as well, because it's an experience not just for the mom and the baby, but also for the family who's in the room, who is there to witness the birth of the new baby of the family. So they help facilitate how the labor will pretty much go, not only in the labor and delivery room, but also in the operation room in case the baby and mom have to go to the OR. Usually that's an emergency section, or they're just not able to deliver vaginally, or there's some other things that are going on the reason why they need to go to the OR. So pretty much the nurse is there to create a nice positive environment because it can be a very stressful time. So having someone there to kind of keep everything on track and to make sure things run smoothly would be the labor and delivery nurse's job or role. Other things that they do is they assist with pretty much the birth. I know I kind of mentioned like the support coach, but literally a labor and delivery nurse is there for the labor of not only the baby, but the placenta, because that also counts as the birth. They're able to help mothers or partners stay on track with the birth plan. Usually when mothers get into the labor and delivery room, they kind of have a plan on how they want to deliver, and the nurse is able to be there to make sure that they stay on board with the birth plan as long as it is safe for the mother and the baby. But it's nice to just kind of know it's kind of nice to know what the mom actually would want to make her experience worthwhile and make it the way that she wants it to be. So with labor and delivery being very, very kind of extreme when it comes to actually having to deliver a baby in the room, it's important to notice and assess for emergency situations, not only for baby but for mom. As I mentioned earlier, baby could have a low fetal heart tone. That's when you call the NICU team. Mom could become lower with her respirations, or she could become tachycardic, or she could become hypoglycemic. It's just important to understand what is going on, not only with mom, with baby, and to be able to use your best judgment on when to call the doctor, when to call the NICU team, and when to do all of those things, or even when to just call and get support from another nurse if you're quite unsure. They also do fundal exams to see how far they're dilated, how far the baby is effaced, what position the baby is in, all of that good stuff to kind of know when they can actually say that they are starting labor. One of the last things that labor and delivery nurses do is they not only help with the labor, but they also help with recovery. A lot of times when I had to go get babies from the NICU, the moms were in the recovery room and the L&D nurse was with them trying to assess vital signs, do a full assessment to make sure that everything is going well and mother is stable enough to be able to go to postpartum. I think that they do, depending on the hospital, but what I'm familiar with is that they kind of look at the recovery for 2 hours before they end up transferring them to postpartum. So all in all, labor and delivery nurses can work in different types of settings, multiple types of settings, and that can include birthing centers, that can include hospitals, and that can also include at home. But just what I'm used to when it comes to labor and delivery nurses, I'm most familiar with their roles when it comes to the hospital. It could very well vary between at home and birthing centers because they are different settings and maybe mothers want different things. Alright, so apologies for the change, but I was just filming the video and I just went to go check the content and literally all of it's gone, and my phone has been doing that because I record on my phone for I filmed this video 4 times now. So I hope that you guys appreciate this video because my camera has been tweaking, twacking. So I'm just going to see where I last started talking and then we'll pick it up from where it is. But now you're being filmed on my iPad, so let's do it. All in all, labor and delivery nurses do all of the roles and responsibilities that I just mentioned earlier. That is a little bit of experience that I've had with L&D nurses. It's pretty much just been based on observation as well as research that I looked into before I decided to pick my specialty of being a nurse. But fun fact, I thought that I wanted to be a labor and delivery nurse when I was in school. I just knew that that was going to be my jam because I just thought that it would be awesome to be there to witness a birth every single shift probably, and to be able to bring life into this world and not only be part of such a special moment with the baby, but also a very special time for the family with them having a new family member being born. So if you ever want to switch your specialty that you're doing with nursing, or if you're thinking about being a nurse and you're worried that you're going to be stuck into one specialty, it is okay to switch. It is totally fine. If you want to try a different specialty, literally do it because you have that power to do that. So now we're going to talk about postpartum mother-baby. So let's get into the roles and responsibilities of a nurse who does that specialty. Alrighty. Ooh, my hair is wet. Okay. Now moving on to postpartum mother-baby. A little bit of experience that I've had with this, just so you kind of know where I'm getting my information from, was when the NICU had a low census at my old job, you were floating over to postpartum to help with the babies that were over there. So, postpartum, one thing that they do, which I feel like is kind of in the name, postpartum, it's after the birth, so you're really working on recovery and working on getting the mom back to her baseline before she gave birth. Things definitely change, but it's just important to monitor, and I feel like with this specialty of postpartum, knowing your signs or emergent situations is crucial, because they could be fine with L&D and then they could be having excessive bleeding with you, or they could be having pain in their abdomen, or they could just be not where they want them to be when it's time for them to get ready to go home. So it's important to observe and notice emergent situations, check those vital signs, do those assessments, make sure you get a good report before you get that mom and baby over to your unit and now in your care. So it's pretty big with observation with that specialty. Now, instead of just taking care of the mom and helping deliver the baby, and instead of the NICU, you're just taking care of the baby, postpartum, you take care of the mother as well as the baby together. So you have 2 patients in 1 room. And I'm pretty sure people call them couplets. I'm pretty sure when they get that their assignment. So I don't know the ratio of nurse to patients for postpartum, but I think that it's about 3 to 4, so you have around 8 patients. But the thing there is that in postpartum, the mother and the family is pretty much taking care of the baby. You're just there to support, and you're also there to monitor mom, but you do have to teach parents things and family members things about the baby, because it could be their first baby, their 3rd baby, their 5th baby. Maybe they want to implement new things and what they did to their previous kids. So it's just important to take care of not only the mom but the baby as well. It's important to have a nice and supportive environment, also support mom's partner, mom's family, the family in general, because as I mentioned earlier, maybe it's their first baby and they don't really know what they're doing, but they're very excited that the baby's here. Or maybe this is their 5th baby, but now they want to alter how they take care of the baby and they want to do some changes. Maybe they want to be more exclusively breastfeeding rather than formula feeding, and that can always be tough, and things can just change. So being a supportive environment, especially after what the mom, the baby, the family just went through, this is a very important time in their life, and it would be nice to have someone who is not negative, in a bad mood, or doesn't seem like they want help, because usually if you seem open when it comes to giving help, people will ask the questions, and it's best for people to ask questions rather than to be nervous and not get the answers that they need, and maybe something unsafe could happen. So there is that. Other things that postpartum nurses do is they get ready for discharge needs. That is pretty much, they're there to get ready to go home, whether it be baby or mom or both. So what they do for the baby, based on what I have noticed, is that they complete immunizations, they complete the first bath, they teach how to do a bath to parents, they complete a hearing screen, they draw labs in case necessary, they check the jaundice level to see if the baby has hyperbilirubinemia. They also get a metabolic screen, which they send to the state. They just get everything ready. A car seat test, they make sure that the baby is feeding well, make sure it has a follow-up pediatric appointment. Things like that is crucial. Same thing with mom, with follow-up for the doctor, after they leave the hospital, after they give birth. All of that should be done as a postpartum nurse. In this specialty, I feel like all of them really, with women's health and with being in the hospital in general, is having emotional, compassionate care. I kind of touched on it earlier when it comes to supportive environment, but sometimes this can be a very overwhelming part for parents, especially because maybe the baby isn't feeding as well, or maybe they're working on breastfeeding and the latch or the milk isn't coming in. Just things like that. It's important to be emotionally aware as well as learning on being compassionate, because this can be a very difficult time, and you want to make sure that you are actually there for them and able to help them and succeed in being new parents of a new baby. Other things that you can do as a nurse is you would help with breastfeeding, as I mentioned, or get them in touch with lactation support, work on feeding, show them how to bottle feed, show them when to feed. If a baby is irritable, maybe they need a diaper change, maybe they need to be burped, maybe they need to be fed, maybe they just need snuggles and skin to skin. Helping parents understand what they should do would be important. Educating them on all of those things, on when to change diapers, when to do feedings, when to make sure that the car seat is the right size, that would be important, as well as teaching them how to do a diaper change. Maybe it is dad's first time changing a diaper ever, or mom's first time changing a diaper ever. Teaching them how to do it, just starting from scratch and being open-minded, would be very, very important. And finally, one thing that I feel like you would do as a postpartum nurse would help parents bond with the infant, because that can also be tough, but working them kind of figure out a schedule, working on bonding with them, making sure they are giving everything that they need to the baby, but not only for the baby, but creating a schedule for themselves, a consistent sleep schedule for mom so she's able to sleep, a consistent sleep schedule for dad. Obviously a newborn, it's unpredictable, but trying to help them, giving them all the best tips that you know of being a nurse is kind of what you do as a postpartum nurse. If you have any questions down below, make sure you guys let me know about postpartum, but let's go into my wheelhouse, which is the NICU, Neonatal Intensive Care Unit. So I have a video all about the NICU, a 12-hour shift in my life, kind of just a rundown of everything that I do, but I figured that I would pop it on in here so all of the content is in one place. So when babies come to the NICU, it's either expected or unexpected, but most likely unexpected, because nobody's going to be like, yeah, I'm going to have this baby at 25 weeks. Like, that is in nobody's brain, I don't think. So they come to the unit, whether it is straight from labor and delivery, whether it's from postpartum or outside hospital, or coming into the emergency room when from home. It just depends on the age group when it comes to when you take babies into the NICU. It's like a certain cutoff range before they take them back. But there are 3 different levels in the NICU: a level 2, a level 3, and a level 4. Should have done the numbers different: level 2, level 3, level 4, and they vary on acuity. So level 4 has the most intense patients. Those patients could either be on ECMO, need surgical interventions, maybe they're just very, very premature, genetic conditions, respiratory distress syndrome, all of that stuff. Where the most complex patients are would be in the level 4. Level 3, a lot of times it's babies who are just born from labor and delivery, so that is something to think about as well. That is what I'm mostly familiar with, but now I'm getting mostly familiar with the level 4 babies with the trachs and all of that good stuff. And then level 2 is where they are least complex and kind of closer to getting ready to go home. They just have a couple things that they need to work on, whether it is sugars or Billy lights. They need Billy lights for their high bilirubin levels, or pretty much anything. They will go to level 2. So not as complex, but still tough specialty. So it's just pretty much based on the diagnosis. I kind of mentioned, but the range of things on why babies can go to the NICU would be things that I already kind of mentioned, but we'll go through the list again. Them being premature, which comes with a lot of complex problems after that. So sometimes babies not just there for being premature, it could be chronic conditions due to being premature. Respiratory distress syndrome, so they need oxygen, maybe they're on an oscillator, maybe they're intubated, maybe they need to be trached with long-term conditions of not being able to have their lungs be or fully working for them. Genetic disorders, cardiac issues, hyperbilirubinemia, surgical interventions, maybe their labs were a little bit off, maybe the baby needs to be cooled because of a brain injury, maybe they're hypothermic, hyperthermic, or maybe just the cause is completely unknown. And that could very much be the case on why they are in the NICU. So when the babies do come over from the NICU, you admit them on in, you do your vital signs, you do your assessments, but pretty much what you do as a NICU nurse when you're not doing admissions is you have care times that you end up caring for the baby. So you get an assessment, you get some vital signs, you do the care based on what types of devices that they have on them, whether it's a trach and you're doing trach care, or whether you're doing oral care or suctioning because they're intubated or they're trached, or if they have a G-tube, you're working on cleaning that, or an ostomy, or if they have an IV or a PIC. Pretty much it can range. Literally, NICU is just its whole different world. You think of a whole hospital for all of the adult specialties, and NICU literally has, boom, everything in one place. So that is what you pretty much do with that. You're able to educate, comfort, answer questions to not only parents but family members as well, because this can be definitely a tough time for parents. They are not able to be with their baby 24/7, or sometimes people have to go back to work right away. It can just totally vary, but being there to be supportive and answering questions is very, very important in the NICU, not only in all of the women health specialties, but I feel like in the NICU as well, because nobody wants their baby to be over in the NICU. They want their baby to get better, to be there, and be able to leave, but no one wants them to be there to go home without them. Other things that you do as a NICU nurse would be to assist with bedside surgeries if your hospital has that. You draw labs, you do workups, you help with pre-op, you help with post-op, you place IVs, maybe you assist with inserting a PIC, or maybe you have to insert OGs or NGs. I'm just trying to think of everything that I do. You also work with the doctors closely to figure out a plan of care for the baby, because nurses are at the bedside a lot of the time with the baby and kind of know their baseline. And like I mentioned before, it's just helpful to support parents and focus on parents when they come in, giving them accurate updates when they come in or when they call, because sometimes parents aren't able to visit all the time, so giving updates over the phone could be helpful. And all in all, working in the NICU, all specialties, right when they walk in the door, you want to start working on discharge, but sometimes it can be a lot longer than people anticipated, or it could just be a very long NICU stay. It could range from a couple of weeks to up to a year or even longer, just depending on the case or the baby that you're dealing with based on their conditions. But all in all, your goal at the end of being in the NICU is to send those sweet babies home with their parents, as healthy as they can be and just working on them living their best life that they actually can live. So that is pretty much it when it comes to NICU nursing. There's a whole range of what we do. There's a whole range that L&D and postpartum nurses do. So I really hope that this video was helpful and just gave you a little bit of like quick, straight to the point things of what these nurses do in their specialties. I want to thank you guys so much for watching. Make sure you like, comment down below, subscribe to my channel, and I will see you guys in the next video. Bye, beautiful.